Well, a warm welcome to today's talk. It's Friday the 15th of September. Now, I want to talk about this new information from the CDC today on their advice for the COVID vaccination programme going forward from the 12th of September 2023. And I must say I am somewhat surprised about it. They're recommending COVID vaccines for everyone over the age of 6 months. Now, in the UK, it's over the age of 65. There's been a lot of backpedaling, some might say, in the United Kingdom. So, to be fair, it's only 64 and a half years difference between the thinking of the authorities in the United Kingdom and the CDC on this. Some might say that's pretty well a lifetime. Well, it is a lifetime, it's more than a lifetime for many people. So it just doesn't make a lot of sense, this contradiction. Tension, shall we say, between the two different countries. Anyway, we're going directly from the website here. This is it. So check it out. Links, as always, are in. Updated COVID vaccines are recommended for everyone, 6 months and older. So 6-month-old children, everyone, or every 6-month-old in the United States recommended for COVID vaccine and older will be available at the end of this week. Now, the term safe and effective is not in this communication from the CDC. The term safe and effective has been plastered over official websites in relation to the COVID vaccine, but it's not in this one. Or if it is, I couldn't find it, you find it, let me know. It's not there. Now, they do give some information. Here we have it. Estimated risk of hospitalisation prevented per million doses of vaccines. In 12 to 17-year-olds, 1 million doses of vaccine will prevent 19 to 95 hospitalisations, 5 to 19 ICU admissions, and perhaps 1 death. 5 to 11-year-olds, it will prevent 16 hospitalisations. And in the 18 to 49-year-olds, it will prevent 75 hospitalisations. I know there's not complete data there, but that's what they have deigned to give us. Now, last week we interviewed Dr. Joseph Freeman on his reanalysis of the original Pfizer and Moderna trial data. So I'll be quoting that later on. Now, the Pfizer and Moderna trial data or the FDA have not released the original participant level data, so we don't know these adverse reactions, what age group they're referring to. Why they haven't released that data yet, I don't know. Pfizer and Moderna, we believe, have it. FDA have it. We're not allowed it. We just have to take their word for it. But that did show, let's imagine this group here, that for the Pfizer vaccine, it showed 1,000 or more serious adverse reactions per million vaccines. The Moderna, it showed 1,500 or more. 1,500 or more. Sorry, put the comma in the wrong place. 1,500 or more. So looks like the CDC here is happy to accept 1,000 to 1,500 adverse reactions, serious adverse reactions to the vaccine, to prevent 19 to 95 hospitalisations, 5 to 19 ICU admissions, and perhaps 1 death. Even worse for the younger age group. The older age group makes a little more sense. To prevent 75 hospitalisations, they're prepared to accept 1,000, it would appear, to 1,500 severe adverse reactions. Now, if that mathematics makes any sense to you, do let me know, because I just don't know where their thinking is coming from here. And this is right. Let me just show you on the website. So here's the website here. I did double check this myself because it's just so incredible. For every million COVID vaccine doses, amongst those aged under 50, they're saying by age group there. So that is the figures. Quite incredible. Now let me give evidence for what I've said. So, of course, we're talking about risk-harm analysis here, aren't we? It seems the harms from the vaccines are much greater than the hospitalisations that are going to be prevented. But that's not even the main point, really. The main point is medicine is about the individual. It's the balance of risks for the individual. And this data, to me, indicates that it's not there. This is the paper here, Serious Adverse Events of Special Interest. So serious adverse events. This is the Joseph Freeman that we talked data that we talked to Joseph and his colleagues. Pfizer vaccine, excess risk of serious adverse events higher than the placebo group. Well, it was 10.1 per 10,000. That's 101 per 100,000. And that is over 1,000 per million. Over 1,000 per million. And in the 12 to 17-year-old age group, for example, that's going to prevent 19 to 95 hospitalizations. So we prevent 19 to 95 hospitalizations, but according to the original trial data, over 1,000 adverse reactions. Moderna, it was 15.1 per 10,000. And that works out at 1,510 per million. To prevent, even in the 18 to 49s, to prevent 75 hospitalizations. So which would you prefer? 75 hospitalizations or potentially 1,500 serious adverse reactions? The data we looked at from Western Australia, reporting a wider spectrum of actions, it's 2,641 per million adverse reactions. This really is very strange. It's almost as if the CDC are arithmetically challenged. Anyway, on a completely separate matter, this is from Reuters, March 22nd. Moderna chief executive defended the company's plan to quadruple the price of its COVID-19 vaccines. So it's not doubling it, it's times fouring it. Quite a big increase, you might think. Going up to $130 a dose. If I can get my piece of paper. Yeah, $130 per dose. Per dose. Comes in boxes of 10s. Work it out for yourself. Last time I checked, it came in boxes of 10s. $130 per shot, quadrupling the price. You might think that's outrageous, unacceptable capitalism and profiteering. Of course, I couldn't possibly comment because I don't have the inside information as how much this stuff costs to make. But they were selling it for 4 times less. Pfizer last year suggested roughly the same, $110 to $130 per dose. Dear. We looked at this recently, the British Medical Journal. From the FDA to the Medicines Healthcare Products Regulatory Authority are drug regulators for hire. Now, the money derived from industry, the US Food and Drug Administration, it's $3.16 billion. They also point out the revolving door. 9 out of 10 of the FDA's past commissioners, 2006 to 2019, went on to secure roles linked with pharmaceutical companies. 2005, House of Commons, industry funding could lead the mRNA to lose sight of the need to protect and promote public health, above all else, as it seeks to win fee incomes from the companies. Now, as I say, I'm sure this is nothing to do with the fact that we can anticipate, based on the original Pfizer and Moderna trial data, more than 10 times more adverse reactions from the vaccine than we can expect to prevent hospitalizations. But it's interesting that these two, as we say, we can't possibly say there's a link between those. But that's what the House of Commons Committee says. British Medical Journal investigation, we found that industry money permeated the globe's leading regulators, raising questions about their independence. Really suspicious lot at the BMJ. Writing in the BMJ, like the FDA, the TGA, that's the Australian Therapeutic Goods Administration, was founded to be an independent institution, however, being largely funded by fees from companies whose products it is charged to evaluate, is a fundamental conflict of interest. It's a prime example of institutional corruption. Strong words there in the BMJ article. It's no longer possible, strong words, it's no longer possible for doctors and patients to receive unbiased, rigorous evaluations of drug regulators. This now appears to be impossible. Talking about the FDA, It's the opposite of having a trustworthy organisation, independent and rigorously assessing medicines. They're not rigorous, they're not independent, they are selective, they withhold data. Doctors and patients must appreciate how deeply and extensively drug regulators can't be trusted so long as they are captured by industry funding. Now, just how dangerous is COVID now? Well, we've seen how dangerous it is. That the vaccines we can expect to prevent relatively small number of hospitalizations, especially in the younger age groups. So 12 to 17s, who the CDC is advising get vaccinated ASAP. 19 to 95 hospitalizations, 5 to 11, 16 hospitalizations can be prevented with 1 million vaccines. 18 to 49, 75 hospitalizations prevented, but potentially 1,000 to 1,500 adverse reactions. It just doesn't make any sense. Anyway, let's just, before we finish, look at the symptoms of COVID now, because you always want to know if you're going to get it or had it. These are the symptoms at the moment. They are the symptoms of a common cold for the vast majority of people. Sore throat, 56% get a sore throat who get COVID infection. Runny nose, headache, blocked nose. Just so familiar. I remember having these as a child, you know, Mum, why do colds last so long? Why do we have colds, Mum? You know, I had this when I must have been about 5 or something. Yes, we've lived with these all our lives. Sore throat, runny nose, headache, blocked nose, cough with no phlegm, unproductive cough, sneezing 53%, hoarse voice, some bring up phlegm, especially later on 37%, feeling a bit achy, muscle aches and pains, fatigue, dizziness, lightheaded 22%, altered smell 22%, swollen neck glands 20%, sore eyes, loss of smell, shortness of breath, earache, chest pain, tightness, fever, joint pain, especially in the shoulders. So just the sort of, for most people, it's this sort of common cold type symptoms that we would expect. I could say more. I did prepare some information on individuals, but I'm not going to do that. Read the BMJ article for yourself. But there's the data from that study, and there's the data from that study. To me, the risk-benefit analysis does not add up. What is going on here? And then, as a separate topic, we looked at the financial interests that are at play. Just thought I'd put those in the same video, just say making 2 videos. Anyway, we'll leave it there. Questions to be asked of your healthcare provider. I can't tell you what to do, but you can discuss this with your own healthcare provider and put these points forward and optimise your health over the coming weeks, months, years. Thank you for watching.